21.2% extra fullness. That is what this guy added to his hair density in just 1 year, even though most people probably wouldn't have guessed that he was even losing his hair in the first place. Men, it is never too early to start hair retention measures. You do not have to wait until you see drastic hair recession or crown thinning to get started. Take my Matt Damon looking friend here. At 37 years old, he had staved it off for that long, but he was finally starting to notice that his hair was feeling thinner as he was washing his hair, styling his hair, even though nobody else around him was ever commenting on it or suggesting that he was losing anything. But because he intervened early, he was able to regrow, re-densify a lot of that thinning. And for that effort, I sent him to one of the best, Dr. Gary Linkov. You know him here around YouTube. I wanted my friend to get ahead of that further thinning, to retain what he had, and to just bulken it up so he would never even have to consider a hair transplant. And no, this is not a sponsored video with me and Dr. Gary or Feel Confident. This is just a collaboration between us with one shared goal: to prove that you don't need to have this drastic before and after transformation to actually have good results. Sometimes the results are in the data and in the numbers and just what you yourself can feel as you wash and style your hair. And with that, I'm going to kick it over to Dr. Gary. In the meantime, please like this video and subscribe to this channel for more men's grooming content.
Most guys wait too long before starting on the right medical therapy to help maintain their existing hair and to see some improvements. A lot of patients come to me and they've lost so much hair that one of the only things that can help them is surgery. But more and more people are realizing the importance of trying to prevent further hair loss, so you can keep as much as you have now and then gain some additional hair volume and thickness and maybe even some density with additional medical therapy and sometimes surgical intervention. This patient came to us looking to improve his hair even though it was looking good already, but he was trying to maintain it. He didn't want to lose any more hair and he was trying to maximize what he already had. And to do that, we started him on oral finasteride and oral minoxidil. We also got him a low-level laser light cap and he got started on ketoconazole shampoo. We were also doing PRP for him using the M-Site system at 3-month intervals. And we ran a series of trichoscopy exams for him looking at the number of hairs per centimeter squared and the caliber of the hair. And we examined it before he started treatment with us, at the 3-month mark, and at the 1-year mark. And what we found is that the hair density and the caliber increased at the 3-month mark. And then at the 1-year mark, it actually went down just a little bit, but it still stayed higher than his baseline numbers. What that tells us is that there was early anagen recruitment. The hair was getting into that growth phase with the various treatments that he was doing. But over time, some of that hair went into the telogen phase or the resting phase, so the numbers came down just a little bit. But again, when you compare it to his original numbers, to his baseline, we saw that nice increase both in the density and the caliber of the hair. His clinical images also supported an increase in the overall fullness of his hair. But again, he started off with a strong baseline, so that delta, that difference of looking at his before and afters maybe isn't so obvious to the naked eye for people who aren't used to looking at hair as often as I am, but you can still see a very nice boost. And because he did so well with starting medical therapy before he lost a ton of hair, his chances of needing a hair transplant are very low. So now, to continue to enjoy his hair, he basically just needs to stay on this medical therapy regimen. I appreciate him trusting us with his hair, and I look forward to continuing to help him track his progress, and we will be there to help optimize his hair in any way possible.
To echo Dr. Gary, what's the most interesting here is that the data reflects exactly what my friend was feeling. Even if nobody else could tell that his hair was thinning, he knew it himself. He had that intuition. And the results after the 1 year proved that he was correct. He had lost a lot and he had a lot of potential to regrow. Let's dive into the hard numbers that Dr. Gary presented from their scans. At the start, my friend had 181 hairs per square centimeter in his frontal density, and the average density of each of those individual hairs was 54 microns. And then just 3 months in, after that initial surge, he went all the way up to 195 hairs per square centimeter with the average hair thickness of 63 microns. So looking at these numbers, you can see that not only did the number of hairs increase, but the density of each hair increased as well. So you get this double densification going on. All right, now by the 1 year mark, these numbers stabilize, they plateau. It's just the number of hairs that they are expressing on average at a given time, even though they have more active hairs on the head that are just in those different cycles of growth. But after the plateau, if you want to look at where my friend leveled out, he went from 181 hairs per square centimeter to 191 hairs per square centimeter. And perhaps even more importantly, the average thickness of each hair went from 54 microns to 62 microns. But then you have to look at the expressed percentages to see the actual improvements here. So he increased 5.5% in terms of the number of hairs expressed on his head at a given time. However, his hair thickness jumped all the way up to nearly 15%. It was 14.8% to be exact. But then when you take those two things, the increase in number of hairs and the increase in each hair's density, that means his average density increased 21.2% overall. And let that be the main takeaway here. No matter what age you are, no matter where you're experiencing hair loss, if you have noticed thinning in the last year or two of your life and you think that you can bring back some of that density, get started, because you can bring back even more than my friend has potentially. You will maximize your long-term results, your long-term retention, and unlike me, you might never need a hair transplant. I'll end this video with a brief chat between me and my friend just so he can outline all of the different measures he was taking and exactly the increments or the dosages so that you get a feel for what he was doing. He's using different things like the Feel Confident prescriptions from Dr. Gary's clinic. He had the quarterly PRP and the at-home LLT, some shampoo that he was using strategically. I'll let him explain all of it. In the meantime though, I have a bunch of other hair loss, hair retention, hair transplant videos on this channel. We cover all things men's grooming, but we do a lot on the topic of hair loss and retention. You can check out an entire series, in fact, that I did following a friend of mine who got a hair transplant in Istanbul and regrew his hair over the next year. We're just about to hit that 1 year mark in that series. We also have a full episode of our men's grooming podcast, Spiffy, regarding hair retention matters. We've also got some on just guys who are embracing going bald, as well as toupees and what those entail. So give us a listen, find us wherever you get your podcasts. And now here's my Matt Damon looking friend explaining everything he did to increase his hair density over the course of 1 year by 21.2%.
I just started to notice some hair thinning in my late 30s. It was something that I noticed suddenly. It was not something that I ever really thought I was going to be dealing with maybe until later in my 50s or 60s. I noticed that I had some real gradual thinning over the last 2 or 3 years. And my hair was still in a good spot, but I was kind of curious if I could maybe stave off some of that thinning. I started my hair loss plan in January of 2025. I was taking oral minoxidil, oral finasteride, PRP every 3 months. Also the laser cap HD Plus, doing that about 10 to 15 minutes per day. Both of the prescriptions were from Feel Confident, and I was taking 1.25 milligrams of minoxidil every day and didn't really want to do full on the finasteride. So I was taking a 0.5 milligram tablet every 3 days. And I was also using ketoconazole shampoo 2 to 3 times per week, especially after like a workout where I sweated a lot. After a year, I would say that I noticed quite a bit of change, mostly in the sense that my hair just felt healthier. It felt fuller. I think every round of PRP that I did, I would feel maybe 2 or 3 weeks afterwards that my hair did feel, a little bit better. I could see photos and day to day that it did seem to be in a better place. When I got the results, I saw that there had been improvement in the middle of my process and then a little bit of a plateau towards the end. They were really clear that that is actually a fairly good sign. There were some gains made and then it more or less stabilized. To see the actual numbers makes sense to my personal experience.
Please give this video a thumbs up and subscribe to this channel for more men's grooming content. You can also visit us on the web at grooming.tips for our articles, our free men's grooming newsletter. You'll find our podcast Spiffy there as well. And you can find us on social media at Blueprint Grooming.